Hypothyroidism is basically a condition associated with reduction in thyroid hormone production. Thyroid hormone is required for normal metabolism and growth. And this deficiency has major consequences on fetal development as well as intellectual and physical development in infants and children as a cause of cretinism. In adults, it may be the cause of several problems, including heart disease, menstrual irregularity, and also infertility, mental health conditions, and dementia. Iodine replacement is not the treatment for hypothyroidism. Screening for hypothyroidism in all newborns and every 5 years in adults after age 35, especially females, by measuring TSH, that's thyroid stimulating hormone levels in blood, where possible should be encouraged always. The causes are antibody related thyroid gland destruction, subtotal thyroidectomy, pituitary surgery or lesions, congenital, and also severe iron deficiency and drug induced, for example, amiodarone and radioiodine therapy. The symptoms are general weakness and tiredness, intolerance to cold environments, constipation, weight gain, hair loss, dry skin, hoarse voice, memory loss. Goiter may be present. Abnormal menstrual periods and subfertility in adult females. Also poor growth, development, and poor school performance in children. The signs that are usually elicited in neonates are excessive sleep, feeding problems, and prolonged neonatal jaundice. Also in children are cretinism, which comprises of mental subnormality, short stature, large tongue, dry skin, sparse hair, protuberant abdomen, umbilical hernia, and abnormal faces. In adults, the signs are slow pulse, usually less than 60 per minute, dry coarse skin, puffy face, pallor, hoarse voice, slow reflexes, dementia, and goiter may be present. Investigations are thyroid function test, free T3, free T4, and TSH. Also fasting blood lipids for elevated cholesterol levels. The main treatment objectives are to correct blood level of thyroid hormones, to maintain lifelong normal levels of thyroid hormones. There's a non-pharmacological treatment. There's surgical intervention for pituitary lesions where necessary should be carried out. Pharmacological treatment, initial treatment and maintenance. You start treatment with a low dose of levothyroxine, especially in the elderly and children, as well as individuals with heart disease, for example 25 to 50 microgram, and you adjust dose as appropriate every 6 to 8 weeks until the TSH levels are within normal reference range. The treatment is often lifelong. Okay, so you give levothyroxine oral in adults 25 to 200 micrograms daily. In children more than 12 years is 25 micrograms daily with a maximum of 200 micrograms daily. And between 2 to 12 years, you give 25 micrograms daily in a maximum dosage of 100 micrograms. Less than 2 years, 25 to 75 micrograms daily. The referral criteria refer diagnosed or suspected cases of all ages, especially children with intellectual impairment and individuals with pituitary disease to a specialist.